So this is part 2 of the sensory system. So for this video, I'm going to be covering the sense of sight. So we're going to be talking about the eye. So you have visual accessory organs. So the eyebrows, eyelids, conjunctiva, eyelashes, lacrimal apparatus, and the extrinsic eye muscles. So for your eyebrows, they serve as a protective role. They keep perspiration, so they keep sweat out of your eyes, and they shade the eyes from glaring sunlight. And they also perform a cosmetic role and participate in your facial expression. So that's going to give the raised eyebrows look. Your eyelids, they're called palpebrae. They project the eyes, and they prevent the entrance of foreign objects and wash tears over the surface of the eye. So the upper and lower eyelids, they meet at the corners of the eyelids. The corners are called the inner and the outer canthus. So your eyelids are composed of 4 layers. You have skin, skeletal muscle, connective tissue, and an inner lining called the conjunctiva. And your skeletal muscles are what open and close the eyelids. So I'll zoom in so you can get a picture there. So you see here is your inner canthus. And you have the outer canthus here. Here's another picture of the same thing. Whoops, let's go back. So you have your inner and your outer. Okay. So the eyelids, your eyelids normally cover a small part of the upper iris, which is the colored part of the eye. And it should not cover the pupil. So sometimes the patient cannot lift the eyelid completely, giving the person a sleepy look. And this condition is called ptosis of the eyelid. So the upper eyelid of a person with an overactive thyroid, they may appear to be pulled up too high, thereby exposing the white sclera above the iris. So this is called lid lag. So occasionally a hair follicle at the edge of the lid becomes infected, usually by staph. And this infection is called a stye, and that's where it's going to be red, swollen, and painful. So let's take a look at the stye. So it can be down here, or it can be in the upper portion here. And ptosis, like we said, that's where they can't fully lift the eyelid. So that's a picture of that. Okay, so the conjunctiva. It is a thin mucous membrane that lines the inner surface of the eyelids. The conjunctiva also folds back to cover a portion of the sclera on the anterior surface of the eyeball. And this part of the sclera is called the white of the eye. So the conjunctiva does not cover the cornea. It secretes a thin mucous film that moistens the surface of the eye. The anterior surface of the eye, it also must be kept moist, otherwise it will ulcerate and scar. So the conjunctiva is very vascular. It has many blood vessels, and evidence of its wrist vascularity is the bloodshot appearance when the blood vessels are dilated. So pink eye, also associated with dilated blood vessels, is a highly contagious bacterial or viral conjunctivitis, and it is commonly seen in children who don't maintain good hygienic conditions. And it can also be caused by irritation and allergies. So let's take a look. This is your conjunctiva. It's that inner lining. Okay. And in a person with pink eye, you're going to see where it's reddened here. There's inflammation. The eyelid is swollen. Okay. Your eyelashes, they line the edges of the eyelid, and their purpose is to help trap dust. And touching the eyelid, it will stimulate blinking. Let's talk about your lacrimal apparatus. So the lacrimal apparatus, it's everything to do with your tears. It secretes and distributes the drainage of tears. So it's composed of the lacrimal gland and a series of ducts called your tear ducts. So the lacrimal gland is located in the upper lateral part of the orbit. And the lacrimal gland, it secretes tears which flow across the surface of the eye toward the nose. So the tears, they drain through small openings called the lacrimal puncta, and then into lacrimal canals and nasolacrimal duct, which eventually empties into the nasal cavity. So the nasal lacrimal ducts can become swollen and closed when a person has a cold, and the tears cannot drain, so they spill out onto the cheeks. So your tears, they perform several important functions. They moisten, lubricate, and they cleanse the surface of the eye. Tears also contain an enzyme called lysozyme, which helps destroy pathogens and prevent infection. And blinking stimulates lacrimation and helps spread the tears over the surface of the eye. So let's take a look. As you can see here, here's your lacrimal gland. Okay, so when you have your tear, it's gonna come down through the sac, out through the canal, and into the nasal lacrimal duct. So let's rethink. What is the term for when a patient is unable to lift the eyelid, giving them the appearance of a sleepy look? Ptosis. The inner lining of the eyelid is called conjunctiva. What is the function of the lacrimal apparatus? So the lacrimal apparatus is concerned with the secretion, distribution, and drainage of tears. So let's move on to the eyeball. Most of the eyeball sits within the bony orbital cavity of the skull, partially surrounded by a layer of orbital fat, so it's well protected there. And it's composed of 3 layers: the sclera, the choroid, and the retina. So in the sclera, it is the outermost layer of the eyeball. It is a tough, fibrous connective tissue that covers most of the eyeball. So the sclera helps contain the contents of the eye, and it also shapes the eye and is the site of attachment for the extrinsic eye muscles. A transparent extension of the sclera is called the cornea, and the cornea covers the area over the iris, which is the colored portion of the eye. So in your cornea, it is avascular, meaning it contains no blood vessels, and it's transparent, meaning that light rays can go through the structure. And because light enters the eye first through the cornea, it is called the window of the eyes. The cornea has a rich supply of sensory nerve fibers and is therefore sensitive to touch. So let's take a closer look. So you have your sclera here, and then the cornea is this outer layer of the eyeball here, okay? Again, in this picture, so this is the cornea here, okay? It's transparent of the sclera, okay? So your choroid. It is the middle layer of the eye, and this layer is highly vascular, so it has a lot of blood vessels, and is attached to the innermost layer, which is the retina. So it performs 2 functions. It provides the retina with a rich supply of blood and dark pigments located in the choroid, and they absorb any excess light to prevent glare. The choroid extends towards the front of the eyeball to form the ciliary body and the iris. So collectively, the middle layer, choroid, ciliary muscle, and iris is called the uvea. The ciliary body, it secretes a fluid called the aqueous humor and gives rise to a set of intrinsic eye muscles called the ciliary muscles. The most anterior portion of the choroid is the iris, which is the colored portion of the anterior eye. The opening or hole in the middle of the iris is called the pupil, and the size of the pupil is determined by 2 sets of intrinsic eye muscles located in the iris. And the iris regulates the amount of light entering the eye. So let's take a closer look. You have your sclera here, the white part. You have your iris, and in the middle is your pupil. Okay, here's another picture here. So you see those outer lining. You have that inner lining, the middle layer, that's your choroid here. Okay. So the retina, it is the innermost layer of the eyeball. It lines 2/3 of the eyeball. And the retina is the nervous layer containing the visual receptors, which are sensitive to light and are therefore called photoreceptors. So what you want to remember is the two types of photoreceptors are rods and cones. So the rods are scattered throughout the retina, but are more abundant along its periphery. And the rods are sensitive to dim light, and they provide us with black and white vision. So the cones are most abundant in the central portion of the retina, and they provide us with color vision. So your rods, again, that's for black and white vision, and the cones are going to give us color. So you can remember C for cones and C for color. So the area of the retina that contains the highest concentrations of cones is the fovea centralis, and an area in the center of a yellow spot called the macula lutea. So because the fovea centralis contains so many cones, which is your color, remember, it is considered the area of most acute vision. So let's take a look. Okay, you see your retina here. Is that yellowish lining, your choroid, that's going to be that middle layer. Over here you see your photoreceptor cells. So you see you have your cones and your rods. Okay. So a second small circular area of the retina is the back of the eye. And the neurons of the retina converge there to form the optic nerve. And it contains no rods or cones. So this area is called the optic disc. Because there are no photoreceptors in the optic disc, images that focus on this area are not seen. So the optic disc is therefore called the blind spot. So a head-injured person, they may develop increased intracranial pressure as the brain swells, and this increased pressure pushes the optic disc forward. The bulging of the optic disc seen on ophthalmic examinations is called a choked disc or a papilledema. The eyes can provide a wealth of information about a patient with a head injury. Okay, so there's another picture there. So now let's talk about cavities and fluids. So there are two cavities in the eyeball, the posterior and anterior cavities. So in the posterior cavity, it is larger and it is located between the lens and the retina. And the posterior cavity is filled with a gel-like substance called your vitreous humor. You can see that in this picture here. This is an actual eyeball. So you see that gel substance there. So the vitreous humor, it gently pushes the retina against the choroid layer, thereby ensuring that the retina receives a good supply of oxygenated blood. So immediately after death, the concentration of potassium ion in the vitreous humor, it increases slowly and consistently. So its measurement is used to determine time of death and is considered more accurate than the onset of rigor mortis. So here's another picture here. Your vitreous humerus, that is the gel-like substance. Okay. So in the anterior cavity, it's located between the lens and the cornea, and the anterior is filled with a watery fluid called the aqueous humor. You can kind of remember that as aqua, which is water, okay? So it's produced by the ciliary body, and it circulates through the pupil into the space behind the cornea, and it performs two functions. So it maintains the shape of the anterior portion of the eye, and it provides nourishment for the cornea. The aqueous humor, it leaves the anterior cavity by way of tiny canals located at the junction of the sclera and the cornea. So these outlet canals are called venous sinuses, or your canals of Schlemm. So drainage of the aqueous humor through the canals of Schlemm, they may become more impaired, and consequently the aqueous humor accumulates in the eye and elevates the pressure in the eye. An elevated intraocular pressure is called glaucoma. So glaucoma is serious because the elevated pressure compresses the choroid, it chokes off the blood supply to the retina, and it damages the optic nerve. So you can see in a normal eye versus the eye with glaucoma, you have increased pressure there. It's pressing on the optic nerve. Okay, you have a buildup of the aqueous humor. Okay, again, you see the pressure. Too much fluid stays in the eye, and this increases pressure. And then you can see on the bottom picture here, this is a picture of glaucoma. And you can see that versus a cataract. So you see with the glaucoma, you have that buildup of the aqueous humor fluid. Okay, so let's move on to muscles of the eye. So you have extrinsic and intrinsic. And the extrinsic eye muscles, they move the eyeball and its bony orbit. So the intrinsic eye muscles, they move structures within the eyeball. And you have 6 extrinsic muscles attached to the bone of the eye, orbit, and the sclera. So there are 4 rectus muscles and 2 oblique muscles. So you have the superior, inferior, medial, and lateral rectus. And then you have the superior oblique and the inferior oblique. So you can move your eyes up and down and sideways because of the rectus muscles. You can also roll your eyes because of the oblique muscles. So the extrinsic muscles are inverted by 3 cranial nerves, with the most important being the oculomotor nerve, which is cranial nerve number 3. So here's another picture here. As you can see, those are your muscles. Lateral, it's going to rotate the eye laterally. Superior, it's going to go down and laterally. And inferior, it's going to go up and laterally. So up and to the side, down and to the side, and then it's going to rotate. So what about lazy eye? So normally, both eyes work together and focus on one subject, and the brain forms a single image. So sometimes both eyes do not focus on the same object, usually because the muscles of one eye are weak or lazy, and therefore are unable to move the affected eye into position. So the occipital lobe is then presented with different information from each eye, and the occipital lobe, however, can't process both signals. So it receives information from one eye and suppresses information from the lazy eye. And if uncorrected, the lazy eye will become non-functional, which can lead to blindness. So loss of vision resulting from lazy eye suppression is called amblyopia. So as you can see there, that's the lazy eye. Muscles of the eye, the intrinsic. So the intrinsic muscles are smooth muscles. They're located in the eyeball, specifically in the iris and the ciliary body. And there are 3 intrinsic eye muscles. So the iris is composed of 2 eye muscles, the radial muscle and circular muscle. And these muscles control the size of the pupil and therefore regulate the amount of light that enters the eye. The muscle fibers of the radial muscle are arranged like the spokes of a wheel. So contraction of the radial muscle causes the pupils to dilate, thereby increasing the amount of light entering the eye. So sympathetic nerve fibers supply the radial muscles. Thus, a sympathetic nerve stimulation causes pupillary dilation, which is called mydriasis. So drugs that dilute the pupil are called mydriatic agents. The second muscle located in the iris is the circular muscle, and contraction of the circular muscles causes the pupil to constrict, thereby decreasing the amount of light entering the eye. So the circular muscle is supplied by parasympathetic nerve fibers and the ocular motor nerves, and parasympathetic nerve stimulation causes pupillary constriction or miosis. So drugs that constrict pupils are called miotic agents. And some drugs, such as opioids, constrict the pupils so intensely that the pupils are described as pinpoint. So your mydriatic agents, they're going to dilate, open it up, and your miotic is going to constrict the pupils. So here's a picture here. As you can see, you can remember the mydriasis because it has a D, so it's going to dilate. And with miosis, it's constricted, so you're going to have that pinpoint pupil. Okay? So the third intrinsic muscle is the ciliary muscle. They arise from the ciliary body. The ciliary muscles attach to the suspensory ligaments, which in turn tug on the lens, causing the lens to change its shape. So here's a picture here. Here's your ciliary muscle. Okay. Pathway of light. So for us to see, light waves must enter the eye through the cornea and focus on the retina. Light must pass through the lens. So a clouded or cataract prevents light from reaching the retina and stimulating the photoreceptors. So therefore, the cataracts impair vision. The same holds true for a scarred cornea. So this is saying that if light doesn't pass through because you have something blocking it, that cataract, it's not going to be able to, it's going to impair your vision. So as you can see, you have your normal eye on the left, and on the right you have that cataract. And the cataract, again, it's clouding of the lens in the eye that affects your vision. So there would be the cataract in that patient. So we have what's called refraction and accommodation. And this is basically when you're doing your Perla tests. So that's when you're having your patient look at your pen light and they're following it, and you're seeing if the pupils are going to constrict and dilate as the object moves away or closer to them. And light waves must bend to focus on the retina. So the bending of the light waves is called refraction. And so what's important here, you have what's called the emetropia. That refers to the ability of the eye to reflect light without assistance of corrective lens. So with advanced aging, the lens loses some of its ability to change shape, thereby diminishing the ability to accommodate for close objects. This condition, which is often evident after age 40, is called presbyopia. So persons with presbyopia have difficulty adjusting to close objects. And here is a picture here. And this is showing the lens ages and stiffens, bringing the focal point behind the retina and causing blurry vision. So you have the Snellen chart. This is your 20/20 chart. So a score of 20/20, it means that the person can see at 20 feet what a person with normal eye function can't see. A person of 20/40 means that a person can see at 20 feet what a normal person with a person with normal vision can see at 40 feet. So 20/40 vision is less perfect than 20/20. And then a score of 2200 indicates severely impaired vision and the person is considered legally blind. So here is a picture of the chart here. Okay. So let's rethink. For humans to see, light waves must enter the eye and bend to focus on the retina. What's this called? Refraction. Which structure of the eye contains the photoreceptors and converges to form the optic nerve? The retina. Which structure of the eye is composed of tough, fibrous connective tissue and is the site of attachment for extrinsic eye muscles? The sclera. Increased intraocular pressure can lead to what condition? Glaucoma. Which structure of the eye provides the retina with a rich supply of blood and absorbs excess light to prevent glare? Choroid. Okay, so that ends part 2. In part 3, we're going to be covering the ear. So go ahead and click A&P of the ear, and I'll see you over there.